Welcome to the Healing Grove Podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Welcome, everyone, to the Healing Grove podcast. I'm delighted today to bring you my good friend, Dr. Roger McFillin. Hi, Roger.
Good to see you again, Kristin.
Always good to see you. So everyone, this is Dr. Roger K. McFillin. He's a clinical psychologist and the executive director of the Center for Integrated Behavioral Health in Bethlehem, PA, which is right down the street from me. He's also hosted the Radically Genuine podcast and board certified in behavioral and cognitive psychology by the American Board of Professional Psychology. He's also a diplomat of the American Academy of Cognitive Therapy and specializes in cognitive behavioral therapies for the treatment of post-traumatic stress, eating disorders, and those struggling with anxiety, mood, and chronic suicidal behaviors. In addition to all that, he's a passionate educator, which is kind of where our paths first crossed, I think. You were co-leading the 16-week parent-child program in DBT, or dialectical behavioral therapy, at your center. And while my kid was on the other side of the wall with your colleague, all of us parents got to sit with you every week, learning how to better regulate our own emotions so that we could be better parents to our kids. It was awesome. My husband and I still talk about how it was like the best crash course in parenting that we never got until, 20 years into parenting, and wish we'd had earlier. But that's not the only place you teach, right? You also have been featured as an expert on numerous podcasts, including this one, internationally and nationally, as well as several national media outlets, including One America News Network, National Public Radio, and Time Magazine. You're also an outspoken critic of the modern medical establishment, in particular, the antiquated diagnostic system used by psychiatry, the prescription drug-centric culture, and the widely accepted treatments that can cause untold harm and undermine development of resilience in humans. So I'm really grateful for all that you do, Roger, and I'm so glad that you have agreed to come be a guest speaker here on the Healing Grove podcast.
Yeah, thank you, Kristin. I mean, it's an honor to be back with you. I know we've talked before, and we share similar concerns. Kind of we're in an inflection point in, Western societies, especially as we face health and mental health crises. And one of my major points that I like to share with people who listen to what I'm passionate about is informed consent, the concept of informed consent, because I think, my field in particular, mental health, it's kind of been captured ideologically by a medical system that is aligned with the pharmaceutical industry. And a lot of the modern messages about how to live well or how to deal with adversity, overcome challenges, building resilience have really been kind of captured by an industry that's major goal is to get you on their product. And I think the consequences have been catastrophic. And one of the things that has happened since I started the Radically Genuine podcast and been on more national, international podcasts is I am bombarded with emails about, where do we turn? Whenever I go and speak to somebody, they want to push these diagnoses and they want to push these drugs. And often it occurs within 15, 20, 30-minute interviews very, very quickly, as if anyone's emotional experience can be limited to a quick diagnosis and leaving with a prescription. I think many people understand that who have entered into at least the American allopathic medical system, is that you really have no time to even really be able to investigate all the multitude of legitimate causes that would lead somebody to being physically and emotionally unwell. And what that does is it reduces our language about the challenges of being a human being. And we've lost our collective language of suffering, how to normalize struggles, especially as it occurs at various points in the lifespan. We've kind of been disconnected from our elders, our heritage, our collective ways of traditions in which we support resilience. And, that just comes with, being more isolated, I think, in a lot of ways as a global community, and our information being kind of filtered through us digitally and through exposure to the internet. So it's very easy to be ideologically captured about where you want to focus your attention. And I say, like, where your attention goes, your energy kind of flows. And we are creators of our own experience. We're creators of our own reality. I believe in that fully. And so where we focus our attention is really going to kind of control our emotions, and it's going to manifest itself physically into kind of this material world with our behaviors and actions. And so we can become so simplified, in the way that we talk about emotions, that before you know it, you have generations who experience anything that's uncomfortable, go through any period of like struggle, and now they're self-labeling as if they have a psychiatric diagnosis, and their tolerance for that experience is quite limited, and they just want to escape that experience. And that's why you see dramatic increases on people on mood and mind-altering psychiatric drugs, and the lack of informed consent around what these drugs do, what they don't do, how they came to market, and what are their long-term consequences. They're never provided, and the people who are most at risk, I think, are the younger people. Certainly those in kind of adolescence who are again captured by this idea of some kind of quick fix, or there's something wrong with them if they're struggling emotionally, instead of seeing it as a potentially transformative experience and normal, and we support them as a culture. Instead, we're told that there's something wrong with you, which drives more self-judgment and more externalizing the solution, usually through some sort of drug. And so I think informed consent and changing the conversation around health and well-being is just critical right now.
Yeah, well, you just laid out like all the important things to dig into in the rest of the podcast. So let me see if I can remember them first. But first, before we do that, I want to go back a little bit and just hear your story about how it became clear to you that this was where medicine was going and what your mission was around that.
Yeah, I get asked that question quite often. And I always go back to my first exposure into the mental health system, which is when I was working at a children's psychiatric hospital right out of undergrad. It was kind of the unintended path for me, but I chose that job, and it was life-changing because I saw firsthand, and this was in 1999, how the medical establishment, psychiatry, was viewing, human suffering and human struggle. And when you see kids as young as 5 years old, which were clearly coming from like abusive and neglectful environments, home environments. They were in poverty or witnessed violence. They certainly were not able to fully fathom the degree of trauma that they were in. And you would see their reactions, their behavioral problems that got deemed as psychiatric, to me, were what would be normal reactions to abuse and neglect, right? And so the pathologizing of that, and this was during a kind of a revolution in trying to push pharmaceuticals to the general public around mental health, specifically starting with SSRIs and just continuing to kind of expand that market from the 1990s into the mid 2000s. And I saw kids deteriorate, and at a heart-centered level, like without even being that educated on it, I just knew in my soul that it was wrong what we were doing. And I was always someone who questioned authority. And so I questioned often the doctors and the nurses that were on that unit. And you rarely got any kind of thorough, kind of critical analysis of what they were doing. And I became aware of the hierarchy that occurs in like healthcare settings and in like psychiatric hospitals, and how you fall in line to what the doctor says, regardless of, any concerns about safety or efficacy. I later went into many different settings, including, working in the juvenile justice system, public schools, in-home therapy, getting my doctorate degree. And I did really throw myself into the scientific literature around psychiatric diagnoses and drugs, and was appalled by, what I was understanding and what I was reading. I learned more about how a drug comes to market through the FDA, how a drug company can create a clinical trial to support efficacy, how we don't really investigate long-term safety outcomes, how the drug companies influence the medical system and how doctors are trained. And you just see this increase and increase and increase every subsequent year. And you see the model being pushed out on American television. We have direct-to-consumer advertising. And then when you see the increase of like social media advertising and the pushing of experts around like mental health campaigns, it's very clear that there's a distortion of what it actually means to be human under the disguise that there's some scientific efficacy for what mental health treatments are in the United States. And listen, I'm kind of a simple guy. I look back at data. I've been reading a book that has community surveys dating back like to the 1930s about like diagnoses of depression. Uh, it would be hard pressed to find, if you surveyed 1,000 people, one person would identify themselves as like feeling or being depressed in the 1930s. And it's not like I was an easier time to live. Like we're talking about after, pre-World War II, but after the Great Depression, there's always been challenges and influx of, immigration. Now it would be hard pressed to find 5 people and not find one who would say that they've gone through a depressive episode. So people are identifying as being clinically depressed and anxious at rates that we've never been able to identify previously throughout modern history. Although human suffering is certainly not new, and I think it's just part of the experience and part of our path. The way we frame it is what has changed, and we've medicalized it. And then so we're pushing people to seek that externally through a like a medical label diagnosis and at best a therapy. But what is psychotherapy too, which is another thing that I'm pretty critical of, because there are so many different types of therapies, some with different support, some are nothing more than somebody to talk to. We don't really critically analyze that either. And so honestly, when you look at the data, the more we push mental health treatments, the worse people become. And so I'm asking questions and trying to speak critically about this.
Yeah, you really are. And it's amazing to me that you, well, maybe I don't know. Do you get blowback? Are you getting like a lot of pushback on this? Are people, threatening you? Do you feel afraid to be speaking out so boldly?
I would say that there's multiple stages that exist when you start speaking out like this. And the first one is fear. And I knew when COVID occurred that I was kind of witnessing the same marketing playbook that was used in mental health through psychiatric diagnoses and drugs was used on the greater population regarding vaccines. So I knew that I needed to do something and I needed to speak out. And that's when I started a fairly provocative Twitter account, which I think got the most attention. And then I started the Radically Genuine podcast. And yes, speaking out against what is typical or what is normal, you receive a lot of blowback. And, there's the moments where, am I willing to do this? Like, is this worth it type thing that you go through because you're discredited publicly. Even to this day, if you like click on Google reviews of Center for Integrated Behavioral Health, and we've been open since 2012, and serve thousands and thousands of people, over the course of that time. I mean, I think we serve usually like 300 people a week are coming in and out of our doors. So we serve a lot of people, but then you see like this rush of negative Google reviews when I start out, being outspoken, and people I've never met before, are discrediting me like publicly. So then you start to fear for everything you have. Like, oh, am I going to lose my center? How about taking care of my family? But the truth of the matter is the only way you can be controlled is through fear. And we all have to kind of take a step back and try to understand, why are we here? I've become much more spiritually inclined during this period of time and connect to kind of a greater purpose. And what happens when I start doing that, when I start facing those fears, is that I actually use that blowback to my advantage, because now I know how to respond with credible arguments and not to respond defensively, and to be able to respond critically. And I've started writing on Substack as well, which really helps me to kind of create arguments, or be able to communicate in ways that people can hear it. And what happens is you start seeing, I think, an uprise of professionals across the board, yourself being one of them, who are just, from a compassionate, loving perspective, trying to, talk about where the system harms, and being brave enough to kind of walk away from what that system provides and being critical of that, and trying to create alternatives. And all of those alternatives come from a place of why many of us got into this position in the first place. You to become a physician, me to become a psychologist. It's to serve people. It's caring deeply about people, their health, their well-being. And that serves us too. I mean, we feel really good about having a life with that type of purpose and that type of value. And so that provides a bit of an armor to withstand some of those criticisms. And then as this continues to grow, you meet like-minded people and you see it's a movement. And right now in our country, like Make America Healthy Again, as far as a movement, is something that continues to grow because of, really courageous professionals and non-professionals, journalists who want to, speak out in terms of like medical freedom, informed consent, and making changes to live your life, knowing that we've been under really a veil of propaganda for decades, and we accept it as true, and we've provided too much deference to the medical authority as an expert, and what we've done is we haven't been able to really trust ourselves. And that's a brainwashing that how easily one can kind of walk into that. And so what I'm proud to say right now is I'm just part of a greater movement that wants to contribute around critical thought, around informed consent, being aware of what our rights are as individuals around this, because it hasn't been, it hasn't been followed. I went to school thinking that informed consent was a legal and moral and ethical imperative. Like there was no options. So me getting into conversations with clients about like what I'm going to do and, where is this some science to support this, or what other options do you have, is just natural for me. But the medical system isn't that at all. I mean, you sign off on informed consent before you even meet with the doctor. And what I've found is that the medical professionals today, one, they don't have the time to be able to really sit down and thoroughly evaluate. They're working in these large scale hospital based systems. They themselves don't have the knowledge. They're working off these protocols that are really pushed by major medical organizations who are funded by special interests. And they just kind of repeat the narratives that are provided to them, either that they've learned in their medical training through their own superiors or through conferences or through pharmaceutical marketing propaganda. And these are realms of just really band-aids. And we see a large global movement of people who are just harmed. We see just increase in all different types of disease, as you understand, and we're trying to make sense of it, right? Even as a psychologist, I see people come in and they're reporting, anxiety and mood, but you can see that there's a range of other health related problems that we have to be able to investigate. And although I'm not specifically trained to do that work, we're kind of trained to refer off to somebody else. But if I refer somebody to the typical medical system that at least is in my community, what they're going to do is just, and this is interesting, what I've seen recently, just because the referral comes from a psychologist, they like just put them on an SSRI right away. When I'm just asking for some investigation of health, like maybe some blood work, because I think that they're, certainly, potentially experiencing like some autoimmune concerns, or there's obesity or metabolic concerns that I may have. They're having trouble with their sleep, their diet is poor, they're experiencing multiple comorbidities, and that's not even investigated anymore. And so how do I ethically say that this is a psychological issue that we're going to work on when there's these range of health problems? So I see myself as a behaviorist. I see as someone who is a member of a healthcare system, and I have a responsibility to educate and communicate with my clients that how you feel mentally and emotionally cannot be separated from your general, physical well-being and your lifestyle. And weirdly, this is new to a lot of people. And I think we have to make a change. And in that respect, I think I get a positive response, and people understand it. And some people, unfortunately, they're on 7, 8 different types of drugs, and some psychiatric and others, just prescribed by their medical specialists. And, they interact with each other in ways that, no one has ever investigated. They don't feel well. they're on these drugs that are supposed to help them feel better, at least mask symptoms, and they're not even doing that. And so we require a movement to be able to educate. And I think that the American public is now open to making real shifts in lifestyle and change and be educated and move away from this system that has created so much harm physically. And it all kind of works together. You think about the medical system, the food industry, the pharmaceutical industry. It's like a bit of a trifecta that financially they all serve each other. And that argument, I think, is well understood and helps people to better understand what I'm saying around mental health.
Yeah. So just to break that down for people, so what I'm hearing you say, and I totally agree, is that we're sort of captured by these mainstream um, monolithic mega corporation industries that actually feed each other by making us sicker. So the food makes us sick. We go to pharmaceutical industry, and that makes us, band-aids our illness rather than focusing on the underlying causes. Then we have, the other things that are going on, like the vaccines, which are undermining the immune system and our ability to detoxify and be metabolically healthy, and it all kind of like feeds itself.
It does. And if we don't have like mental health therapists who understand that basic premise and are willing to educate themselves by and all different realms right now, we have opportunities to educate ourselves. I mean, the podcast arena is great. And by no means do I express myself to be an expert in the things that you just discussed, but I want to have the conversations around it. So I have my own podcast that has these conversations, and I want people to be educated on it. And just to understand that if you're going to work with me or you're going to work at our center, that mental health is an active process on so many different aspects. You can't just come in and spend 1 hour a week speaking with me and believe that is going to change the complexity of everything that you're dealing with. I mean, it really has to be an active process and an openness and a willingness to face things that are really, really hard and to change daily behaviors. And, that's not what is, I think, occurring in what is standard mental health care. And standard mental health care really fragilizes the individual, pushes them to be a passive participant in this process, to attach to these labels as if they're legitimate medical conditions, and they're best served by some general talk therapy and prescription. And that's what's creating this harm.
Yeah. Well, I mean, and you speak to the importance of finding a mental health care provider who is aware of these issues and these risks. And I want to talk to you about how people might find someone like that. But first, after hearing what you said about the brokenness of the system, are there people actually out there doing good work? Obviously, I know there are, and you're one of them, but people might be skeptical, like, why would I even bother going to a mental health center if really this is all just an opportunity for growth for me and I can become resilient through this rather than go, get help?
Yeah. I mean, honestly speaking, I think we have way too many mental health specialists. So there's way too many therapists. There's way too many psychiatrists. What I believe is a system that should be reserved for a select few, and that select few should be able to have that opportunity to be able to face whatever they're occurring. I mean, there are legitimate clinical conditions that require help. I mean, uh, post-traumatic stress is something that stands out. People can fall into alcohol abuse and eating disorders. And, there are certainly severe depressive episodes that, require this attention. But I want there to be more specialists and more holistic specialists who be able to understand everything around it and has the time, energy, and space to be able to work with somebody and connect them with other medical professionals that can, see that what it requires to be able to overcome such a thing, and for people who actually believe in like human resilience, and who spend the time kind of historically kind of understanding that there are paths to going through real challenges in life, and it doesn't mean there's something broken within you when you face that. And so I am kind of examining right now how the typical mental health professional is being educated. And there's the most mental health professionals that exist in the system are what's called licensed professional counselors. They're master's students. And really they're being indoctrinated into a greater healthcare system. So, it's a 60 credit master program. They're learning all the diagnoses, the language. They're basically facilitating conversations and then working to be members of the system. So they're the ones that are referring clients to, a physician for an evaluation for a psychiatric drug. They're the ones that are putting the diagnoses on people. They're the ones kind of working from a model that sees them as fragile and disordered rather than a perspective that you are strong and you are resilient and your emotions are gifts and they're reactions to your like internal and external world, and these are opportunities for you to move forward and grow through it, maybe to learn some skills, maybe to make some changes, maybe to face things that are hard. It's just not what I'm seeing because we're doing the interviews here at our center, and we're also a training clinic, so we really pick the brains of these young clinicians about kind of what they're indoctrinated into the system. I mean, I recently had a we recently had a doctoral level trainee here who came from a program where her faculty was involved in how psychologists can influence their patients to take the COVID vaccine. Can you imagine that being the research in from a PhD level psychologist? I mean, that's the greater system that you can get, tied into. And we sit here today. The Pfizer Papers is a recent book that was just released by Naomi Wolf and Amy Kelly. And Aaron Suri was able to, in 2022, be able to, sue the federal government to release the data from the Pfizer COVID trials and how the U.S. government went into partnership to be able to, really mandate that vaccine for people to be able to function in society. And it was this outpouring of people, volunteers from around the globe, to go through all that data. And God, I don't know, it was 45,000 pages or something
Those
of
are
that
the
nature.
papers that they initially said they were going to release like 75 pages a year until they got sued.
Well, no, it wasn't going to be released for 75 years.
Oh, for 75 years. Oh, that's even better.
Yeah,
Okay.
so most people would already be gone.
Yeah.
And this is still a vaccine that's being recommended by the CDC for 6-month-olds. But since I am interviewing on my podcast Amy Kelly, who's a co-author of the Pfizer Papers, on Friday, I'm starting to look into this, and to me, it's clear that we are under attack. We're under attack as a country, because when you look through that data and you see what her team came up with after looking through that, there's only evidence of harm. There's no evidence of any positive effect of that, and that was, mandated on people, and people are still taking it under the disguise that it's safe and effective, and the harms are significant, and it's really, really scary because it makes you question our own government in its role in trying to harm its population. And certainly you can't claim ignorance after, reading this book. You can only step back and see what it is, and it's we're at war. And I unfortunately see that. That's what's happening right now, is our medical system is tied to a greater entity, and it is doing harm on the American people. And so it's up to us to band together to be able to who can we trust, really, is what it comes down to, is who can you trust who's really ethical and willing to kind of step outside their training or their position for who they work for, to be able to fit the highest ethical standard, which is to, let people know, hey, listen, I don't know this. From everything I'm learning, there's harms, and you need to be aware of what those harms are. But you have to be willing to put in the work to do that. And I just think it's so important that a network is created of people across healthcare specialties who are willing to say, hey, this is what I know. This is what I don't know. Here's what I would do myself, maybe for my family. Here's like my conceptualization about what's going on. And I respect your right to make a a choice that's in your best interest or your best family's interest. And that's a respect for freedom. That's a respect for the Constitution. That's a respect for our rights. And that's a compassionate approach. I don't know how we got to the point where there's this paternal and maternal system that exists, and then we have to follow it blindly. And then we can just kind of fall into this division that's created by our government to place us in groups and out groups and to cultivate fear. And that cultivation of fear is why most people went and got that vaccine. You know, for the most part, I don't even think it's fear of COVID itself. It's actually fear of stepping outside of, you know, what you're supposed to do, and that fear conditioning that took place. And so,
Yeah.
you know, I don't even remember what the original question is, but we're back.
No,
You know, we're
you went to a
here.
lot of great places, and you talk about this as sort of need to bring people together to create a network. I kind of feel like someone recently did create a big network of clinicians. Oh, wait, it was you. Talk to us about the Conscious Clinician Collective.
Yeah, I mean, this is my response, and you've been grateful enough to volunteer as a board member. This was my only response to the overwhelming emails that I continue to get, because people are listening, they're facing legitimate challenges, especially if you're a parent of somebody who is young, or you know, a young adult, is because they are kind of feeling consumed by fear and anxiety. They may be struggling with mood. They are exposed to everything in culture that we're exposed to, and they might be saying things that are really, really scary, and they believe that their young person just needs to go through this. It's like a difficult time, a challenge, and they're just looking for good people to kind of give some support and maybe some direction and some information. But I mean, they're concerned about the indoctrination. The indoctrination goes way beyond just the uh, psychiatric drugs and the diagnosis. You know, there's the you know, affirming care for gender dysphoria, which is another large, you know, issue that exists in our country and in my field because of what they're exposed to, popular culture in schools, especially, you know, especially for young girls. It's quite normal to go through a period of kind of, you know, body dysmorphia and like mood related problems that exist during key developmental periods post puberty, and something that, you know, had been normalized previously. And there are some systems in place to support people in going through this. Again, it's now been kind of ideologically captured that, you know, that challenge can be misrepresented as you are not even really a woman. And if you go into a mental health system and they just kind of affirm that reality and they work in concert to kind of create that reality, who knows what is next? Because, you know, we live in a system where a minor can receive invasive medical procedures without parents' consent, and that includes psychiatric drugs uh, or cross-sex hormones or so forth. So these are like critical issues that parents are concerned about. And even if it's not that, let's just say there are struggles that a 15-year-old might be going through. Could you imagine like just handing your child over to a professional who doesn't involve you? You know, are you just supposed to like blindly trust that what happens in that room 1 hour a day is something that fits your family values? Or you can trust that that person is like wise enough to be able to deal with all the complex situations that might arise like in a 15-year-old world, where they might not just create their own you know, reality about who they are, and you don't have the influence to do that. I mean, that's the one thing that's really offensive to me, is how many parents send their children to a trusted mental health professional, and they're just not involved in the process at all, and they feel like they're losing their kids. Like they don't know why they're struggling or what they can do to help. And I think that's just part of some of the indoctrination that you see, that we have to protect ourselves from. And that's why when I considered developing the Conscious Clinician Collective, it was being clear about what I support, and what this organization can support. Because the first thing we have to do is we have to be able to find like-minded professionals who certainly respect the principles of informed consent, medical freedom, and respect for personal autonomy, because whether you can send your kid to a public school, or you can send your kid to a local pediatrician, or you can send your kid to the local mental health care practice. Who is that person? Like, what do they stand for? What do they believe? And is that person getting information that is science-based, where the known harms that exist, are they going to be present? We spoke earlier about the complexity of all this with health. How many legitimate underlying medical conditions get misrepresented as psychiatric? I mean, we see this way, way too often. And before you know it, they're on a number of like very dangerous mind and mood altering drugs that have significant consequences. And you're far removed from what the original problem is. Now you're dealing with side effects of one drug, and then you're provided another one for that side effect, which leads you to increasing a dose and adding another one. And you're way outside any bounds of established safety or efficacy. So the Conscious Clinician Collective is trying to coordinate professionals globally who understand on the mental health side that our emotional states and our struggles are, not medical conditions to drug, but there's a language that we can kind of utilize to be able to understand that emotions are something that have been provided for us as gifts, throughout uh, throughout human history, to be able to survive and to be able to overcome. I personally believe there's a war on human emotions. You hear too many people talk about my depression or my anxiety, like it's something, outside of them to get rid of, instead of like this collective language of like emotional struggle in response to events in our lives to push us to overcome them. And I think we just have to get people who are not going to quickly label and quickly drug, and to understand that there's a story to unfold, and to spend time with people and to investigate. And if we can get groups of people together, it could make it so much easier for people just to, if we had a platform where you can jump on and just put in your locality and see, people who've been able to attest to this conscious clinician compact, which is not that dissimilar from like the Great Barrington Declaration, where groups of scientists have come together just to be able to get their thoughts together on how their field, epidemiology, has been captured by globalists and those who, are seeking a kind of a remaking of society. Well, the same thing should happen in mental health, right? We should, kind of get together and talk about certain things that we universally agree on, but we'll always come back to, informed consent, that the person in front of you has a right to know what you know. And if you don't know, you need to figure it out. That's your responsibility. If you're not fully aware of the harms from any medical intervention, then you're not meeting the standard that exists in your profession. So this is like primary care docs out there who are prescribing SSRIs like they're candy. If you don't understand the legitimate harms that exist, then you're not meeting your ethical standard, and then you're not providing informed consent. It's your responsibility to do so. And what we're seeing, and I'm sure you're seeing it, Kristin, is that you're seeing a lot of medical professionals who are leaving that system. And there's popping up alternative ways of getting helps, subscription models, and so forth. I know this was great to hear. My brother has a 3-year-old son, and they kind of pulled him out of the system. There's a local physician that kind of moved out of the hospital-based system, and there's a subscription model. And the first meeting with him was 45 minutes long. I mean, you're never going to see that in our primary care centers. I think it's like the average is like 8 minutes. It's really become an industry for profit. And, the doctors are working on an assembly line. So this is the Conscious Clinician Collective. If you go to thecccollective.org, it's your opportunity just to read a little bit about us and what our mission is. And we're in the fundraising stages because we're close to getting to the point where now we can build out the platform. And I think once we build the platform, more medical professionals are going to be willing to like really sign up and have their name out there. And so we're getting close to that. And so we really need to be pushed over the edge, because it's going to be a robust platform that we also want to be able to include information for you to do your own research, or at least ask critical questions. Like, and that's one of the things that has been lost from our society. I don't think we're really always asking critical questions anymore. We're not really taught how to think. We're kind of just told what to think. And if anything, kind of post COVID, it's kind of us really kind of taking on that responsibility again, to take care of our families and to ask critical questions to medical professionals because they serve us. And I kind of want to build that platform.
So awesome. And there's, for people who are curious and find their way to the website, I love that you have on the donate page, you have information about how to give, how to share, and how to pray. So people who are not abundant financially right now, or who don't have a wide network of people they think would resonate with this, can also say a prayer and add that to your kind of resources and the energy behind this project. It's so beautiful. Cool. So other than serving as a place for people who are looking for someone in their area with whom to work, who has these sort of this philosophy of resilience over just drug it with the medicine. What else are you hoping the CCC is going to be able to do globally?
Yeah, I think one of the things that, if I step back and I think big picture, and I really hope that what we can do is cultivate a community where people can share their areas of expertise and communicate openly, and we can return to scientific inquiry. I mean, I'm a big believer in science, from a perspective of protecting the welfare of the individual. I think we're in a period of mass experimentation on human beings, without their knowledge. And post COVID, I mean, you go through COVID, and science became a tagline, something that you're supposed to trust. Another reason just to blindly trust the authority figure. When I want to be able to cultivate communities where we can ask critical questions respectfully and openly, so people can hear that and hear those kind of debates. I'd love to be able to have various opportunities for multimedia discussions, around starting with mental health. But as we mentioned earlier, how do you separate a person's mental health from the whole being, your whole physical existence, your spiritual existence, everything that exists here? You can't separate that. And we have to change that paradigm. And so if we can continue to grow and cultivate a community, then you can cultivate places where people can access information. And I want to build an organization of people who want to contribute to that. Talking to Amy Kelly, who is was the co-author of the Pfizer papers, there was this crowdsourced effort across the globe of people with various specialties who came together to dissect those papers and to get that information out. And that is something that inspires me, like the power of the human spirit to come together to protect each other. And that's what I hope that this can, eventually kind of grow into. Is I know how self-limiting the mind is, right? So yeah, I can say, well, first, we're going to get a database where people can do a quick search and then they can meet with somebody and it's an access of information. But no, I don't want to limit to that. I want it to limit to a way where we can all connect against the globe and have conversations and ask questions. Because what happens right now in kind of these dark times is that the authority figure, whoever that might be, is uncomfortable in dealing with what those critical questions might be. And we see all these ad hominem attacks on the person, like exactly what we talked about earlier. When I started throwing myself out there, hopefully with an opportunity to get into this critical dialogue, all you're met with is just attacks on your credibility. And that's eye-opening. And I think it should be eye-opening to, a lot of us in how we view people who put themselves on a pedestal as an expert, and see in the public health community where how often that was done, where, people who had legitimate concerns about a novel mRNA vaccine. We can't even call it a vaccine, you know, medical intervention, and the harms that it could provide were discredited. And then you just create a divide of us against them. So when it comes to my field of mental health, yes, I'm extremely outspoken about SSRIs and psychiatric drugs because I've done the work. I know what the harms are. And there are so many people who've been kind of conditioned to see this as, you know, life-saving kind of medicine. Like, and how often are those words thrown out, like life-saving care, you know, these claims that don't meet the reality of what the situations are. And I tell people, like, when it comes to an SSRI, yes, there might be an emotional blunting effect. You might be in a lot of pain and you take this drug and you get kind of numbed out. But are you aware of the costs? Like, are you willing to take a drug that could provide permanent sexual dysfunction, that is known to provide permanent sexual dysfunction? Are you willing to sign off on a prescription to your 15-year-old child who told you that they are thinking about suicide, and be provided a drug that is somewhere in the realm of 2 to 6 times increase the likelihood of dying by suicide, right? You're not provided this information. And from what I know is if people were provided accurate information around a lot of these interventions, they wouldn't choose them. And now they would be open to alternatives, and they're safer and they're more effective alternatives.
Yeah, thanks for putting such a point on it, Roger. So I know that you have a lot of practices yourself that you both use and teach others to help people move through challenging emotional times, challenging dark times, as you've called them. Would you be willing to share with us some of the things that you found to be really effective?
Yeah, it was interesting. I was watching a documentary on near-death experiences not too long ago. And I've also read a lot of work by Dr. Raymond Mooney on near-death experiences. So I'm openly, you know, come to this podcast today. You know, I see everyone as a spiritual being going through a human experience. I see people as eternal souls. And so I do have a different perspective about, you know, the purpose of life, or meaning of life, the challenges that are inevitable that we're all going to face in this life. And I can't get this one statement out of my head from a gentleman who had a near-death experience and was asked the question by the interviewer, what would God say about religion? With all the different factions and religious beliefs that people have from around the globe, what would God say about such a thing? And the gentleman laughed and he says, I don't think God would have any judgment on such a thing. But I want to ask people a question. What is the first thing you do when you wake up in the morning? Where does your mind go? Where does your attention go? Because that is what you're worshiping. And I thought that was fascinating. So much so that I started integrating it in all my clinical interviews, asking people, what is the first thing you do when you get up in the morning? And, you know, overwhelmingly, people will turn to their phones. And they're going to check their social media. They're going to check their emails. And I'd say, well, whether you're religious or not, that's your religion. I mean, that is what you're worshiping. That's what's going to grasp your attention. And so empirically, we know that the more that you fixate on social media, the news, we'll call it anything the matrix provides, you know, that collective consciousness around ego that provokes such fear and division, that is going to have a profound impact on your mental well-being. And so what I'm really interested in is, what are modern scientific practices that have robust positive outcomes that are also well written about throughout the ages and cross-culturally. And one of those is gratitude practice. And I started a gratitude practice for myself months ago, dating back to June. And it was an experiment for me where I was going to do a 30-day gratitude practice, where the first thing I was going to do when I woke up was going to find a place quietly in a meditative state where I could just bring attention to everything that I have that I'm grateful for. Not everything, of course, you can't do that, but like I tried to like start with a list of 10, and then I would kind of add to it or go in different directions. Because what's really interesting about human beings is we take a lot for granted until it's not there anymore. So, for example, walking. How many times do people really just take a moment to be grateful for the freedom they have in walking? But imagine if you got in a devastating car accident, became a paraplegic, what you would do just to go back in time and to experience that freedom of walking and the joy that would be experienced through it. And so, what I'm sharing with a lot of clients that I'm working with is, well, you have that moment right now. Like you have the freedom to walk, but it extends beyond just walking, right? Like our loved ones that are in our lives, um, the food that we have on the table, that comfortable bed you might be able to sleep in, like all these amazing things that we have in our lives that our attention won't even focus on. Instead, they're going to focus on the division, on the fear, everything that kind of creates the despair that might exist in our lives, and that becomes our reality. And I'm a big believer in we are creators of our own experience. And we don't talk enough about this. This is what happens when you reduce the human experience to a psychiatric diagnosis and a drug, is that we have this mental world, this internal mental world, which is our consciousness. And our consciousness is powerful in how we feel and what we manifest into our lives by what we create. And we are creators. And so that early morning gratitude practice, and then I would end my night every single night. I took these two rocks that I pulled from my yard. They're on my nightstand. Before I go to bed, I grab them and I reflect on like what I'm most grateful for the day, right? So now I'm cultivating my own reality. I'm an active player in it. I'm focusing my attention on the things that are most meaningful. And guess what starts to happen? Guess what starts to happen when you do this? You don't just do it in the morning and you just don't do it at the night. You start bringing attention to all these things in your life in these moments that are really, really special. And then you start seeing everything from a new lens, a new perspective, right? You know, my work or this meeting with you, like this is like an amazing experience that exists right in this now that I see as a holy experience. And I'm just so blessed and to have this conversation and to be in a position to have this type of conversation. So what impact do you think that has on my energy, on my mood, on the next person I'm going to see? Like when I walk out of the studio to see a client. And if I see that client as the most meaningful and important thing in my life right now, because it's in the now, and I generate a gratitude for it. So it's a complete shift in energy, right? So you do those two things. And boy, obviously I didn't stop at 30 days. This is something like brushing my teeth, right? This is something that you just automatically do every day. And I've never had a more robust and profound experience than cultivating this into my day-to-day practice. And listen, life's not always easy, right? Like I think there's a polarity that exists. Like we're going to go through good times and we're going to go through some struggles. Sometimes our energy's up, sometimes it's down. But even in those down moments, it's still an opportunity to bring attention to everything you have even when your mind wants to fixate on what you don't have. And if I could reduce people's mental struggles, emotional struggles, to something simple, which I hate doing, but if I had to, I would say their mental world is driving their experience, and we have more of a choice in that than what we actually think. But they're habitual, they're habits, and we have to get into habits that really enhance our well-being and the lives of everyone around us. And I think that is so powerful. And I'm starting to think that people are afraid of power, the power they have, and considering things from different perspectives, like how safe people can feel from worry, how safe people can feel from creating something in their mind about this really next bad thing that can happen, and they can put themselves in control over it. They can provide this illusion of control, and getting people to observe their mental worlds and what they're creating, is kind of disorienting. It really can be disorienting for some people to see that a lot of what they just told me was completely made up in their minds. And that's not to be offensive or anything, but that's just to, point it out, like, just so you know that that's not really happening, or that's not really in reality, that your mind just created. So what is the impact? Now you have a choice to live that way. You can live with your mind as being a threat detector all the time, trying to scan out all the negative things that can happen to you. You can live in fear. You can be completely tied to the physical body that you're in, and your life can be focused on just staying alive as long as you can. But what's the downstream consequences of this? What impact does this have on your emotional, mental, physical well-being? And these are the critical questions to ask. So I ended up creating a 30-day mindset practice for my Substack, just based on some of these principles about how we can kind of regain control of our mental states and create a life that's aligned with our values and not completely corrupted by fear, which I feel like there's so many outside entities that are so driven to do. And so I hope that gratitude practice is something that your viewers, your listeners can cultivate into their own lives, because I can't imagine something that can provide more of a robust improvement in their quality of life than that. And when you really do cultivate that attention, everything is experienced at a higher level. Conversations, a meal, exercise, a beautiful day, walking down the street. And that's been life-changing.
How could it not be? How can it not be totally transformative? I'm just listening to you and I'm almost crying, thinking about what it is to exist in such a state throughout your entire day. I have a patient who, or a member actually, one of my groups, who recently told me that she had experienced a brain injury, and for like some extended period of time, maybe more than a year, in her words, walked around like a 3-year-old, like didn't have all of the sort of functional capacity of an older person, but also the benefit and value of that, and the kind of joy and awe that you bring to life when you're walking around like a 3-year-old. Like what you're describing reminds me of that. It's just the sort of like beginner's mind of everything's awesome. Oh my gosh, how did I get so lucky? And and it's free to do. Imagine that. It's just
Yeah.
it's in a practice and following through.
It only takes a few minutes, actually. It's not really time consuming.
Amazing. Thank you so much for sharing that with us, Roger. Is there anything else that you feel called to share with this audience of wellness seekers before we wrap it up today?
Well, I think the last thing is just to conclude on the mission of the Conscious Clinician Collective. And that so people really understand it's about a deep respect for medical freedom and informed consent. I think there's so many paths to wellness. I think we're limited. We're limited by our own collective consciousness. We're at a point in time in human evolution. But I think if we open up our minds, that there's probably going to be so many various paths to create peace and to create physical strength and be able to overcome disease. And who are we to limit ourselves in any way, and to corrupt science to be able to limit people's exposure to what exists out there, because what that does is it just prevents innovation. So if you can go to thecccollective.org to try to be a part of the community, even if it's a cup of coffee, the cost of a cup of coffee to donate, we're going to build this thing and going to have it ready by early 2025. I'm committed to that, to building the platform and then going from there. And then the final thing is, if you can't, obviously, if you can't donate, a prayer and telling somebody, if everyone tells three people to go to the Conscious Clinician Collective website, I think people are going to feel like, okay, these are the type of missions that I have to be a part of. Also know that it's tax deductible. It's 5013C, nonprofit. So it is a tax deductible donation if you make that. I appreciate the opportunity to talk about this today.
Well, we appreciate you so much. Thank you again for all that you do and are doing and will continue to do. And I can't wait to be a member of your community and support that work.
Thank you.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.